A perfect afternoon to everyone present here. I am Pallavi R. Kamath, first year MHA student at Prasanna School of Public Health, MAHE, Manipal. It's my honor to welcome all the participants from different countries to benefit from the 13th webinar organized by Manipal Health Literacy Unit, known as MHLU, in collaboration with Symbiosis International University, jointly organizing a free webinar on health literacy for healthcare providers, researchers, policymakers, industry, academia, and the public. Before introducing our webinar speakers for today, I would like to make an essential request to all the participants. I would like you all to kindly mute your cell phones and mic. You may post any queries or questions during the session in the chat box. We will be addressing a few selected questions considering the time limitation. In today's webinar, we will hear experts' insight on professional responsiveness to patients in health literacy and treatment seeking during a stroke. Please note, each speaker will be sharing their insights for 15 minutes. Ladies and gentlemen, please allow me to introduce our first speaker, Ms. Flavian Roca, a highly accomplished nurse with a PhD and MSc in nursing from postgraduate program in nursing at UFG. She specializes in occupational nursing, healthcare services auditing, and higher education training. Ms. Flavian is a reviewer for the prestigious journals such as JBI Evidence Synthesis, PLOS1, Journal for Clinical Nursing, and Stress Health. She is an active member of the Paradigms in Healthcare Assistance and Quality of Life Research Group and the Brazilian Health Literacy Network. Her research focuses on theoretical foundations and the development of technologies to advance knowledge production and healthcare practices, emphasizing health promotion and health literacy. She is also a faculty member in the medicine group programs at UNIFIM's Trinate Go campus, where she coordinates in the realistic simulation laboratory at Facultad Sul Americana. Additionally, she leads courses on the use of academic software and digital platforms with a focus on active learning methodologies. Please join me in welcoming Ms. Flavian Roca. Over to you, ma'am.
Thank you. Thank you so much for the kind introduction. I will share my screen with you now. That minute. Can you see my screen?
Yes, perfect.
Okay, thank you. I'm deeply happy to be invited as a speaker at this event, and I want to extend my thanks to the organizer for this opportunity. I would like to express my gratitude to all the participants who made the effort to join this event, and your presence is truly appreciated, and I'm really happy to share this moment with you. So, this is my presentation overview. I will cover 3 topics today. The first will be professional responsive to health literacy, and the second will focus on the competences of health personnel for practicing health literacy. And the third will discuss the communication process to promote patients' health literacy. So let's start. But what is the responsibility of healthcare professional to the patient's health literacy? Well, in this paper, we explore about this topic. This was the question we sought to answer in this article. The paper contained a scoping review and we mapped the key characteristics of healthcare professionals who are responsive to health literacy of the patients. The main findings include a list of responsive indicators, training option for developing professional competence, and we did a proposed definition of that. What is the responsive? But in this case, when we look about the literature and the practice, we find this definition. This definition is about responsive to health literacy was characterized as those who know the definition and the implication of health literacy for well-being of individuals and can develop, adapt, implement, and evaluate health teaching strategies according to the patient's health literacy. And we find 10 indicators that health professional is responsive to health literacy. A possibilities, what are the indication do? We didn't find 10 key indicators. This includes recognizing the definitions and impact of health literacy, the need to adapt learning plans, identifying signs of low health literacy, and develop education strategy. Additionally, it involves implement and evaluate these strategies, reinforce learning, building relationship with patients and their families, and conducting interdisciplinary collaboration to patient care. So why study the responsiveness of health professional to patient health literacy? Why this important? Inadequate health literacy is associated with difficulty in access healthcare services and is a kind of challenge in health promotion in disease prevention. This situation leads a high healthcare cost and make the healthcare system less efficient. And a good question is how to be responsive to patient health literacy. So it's essential to develop knowledge, skills, and attitudes in health literacy practice. Only when a professional make health literacy a part of daily routine will they be able to provide appropriate response in many contexts. Being responsive to health literacy should become a reality as competence are developed through a habitual practice. The other question is, what are competence? So there are a set of framework based on learning experience that involve their mobilization and synergy of internal and external resource, resulting in appropriate action for a given situation. To understand competences, we must consider it, that they are prediction of actions. Development compensation requires theoretical and practical training and is structured around the learning theories. In the second article, we find something interesting about that. The main question is, what are competence needs for healthcare professional that is responsive to patient health literacy? In this article, we identified a list of knowledge, skill, and attitude that healthcare professional must have to effectively respond to health literacy needs of the patient. The list serves as a guide for identifying key areas to adolescent training, training program, curricula, and assessment tools. In this context, another question is, who is the healthcare professional responsive to patients' health literacy? Oh, I think it's under my screen.
Yeah, I think the sharing has stopped.
Oh, yeah. I will start again. Just a minute. Can you see my screen now?
Yes, ma'am.
Okay. Let me return. Okay. The question is, who is the healthcare professional responsive to the patient health literacy? What they do. So, three topics important in this context. First, knowledge, skill, and attitudes. A professional who possesses the knowledge, skill, and attitude necessary to promote health literacy is equipped to identify and address health literacy related issues efficient. In this paper, we talk about that a little bit. The main questions in this case was, how do healthcare professionals develop the communication process to promote patients' health literacy? It's important to know we have a mode away from the classical communication model where the sender and the receiver have a unidirectional and often hierarchical relationship, like you can see in this picture. In the next, the mode of communication changed. So the current perspective on healthcare requires understand that communication is a dynamic, bidirectional. It's a kind of bidirectional process where healthcare professionals and patients interact and learn from each other. In this context, the information share must be meaningful, understood, and utilize both parties. This is about that, this feature. In this case, an example of this in this picture will illustrate the relationship between healthcare professional, health information, and the patients. Look the difference of the pictures for the last. We can see the bidirectional relationship and dynamic interactions. So I have been studying about that a little bit time, and I would like to conclude my speech today using the phrase that encapsulates what it means to be responsive to patients' health literacy. If one is truly to succeed in leading a person to a specific place, on the must first and foremost take care to find him where he is and begin there. This is the secret and the entire art of helping. So, thank you. And Let me know if you have a doubt about my speech. Thank you so much.
Thank you so much, ma'am, for sharing your valuable insights on the topic. If any of the participants have any questions, feel free to put it up on the chat box. It will be taken up at the end of the session. Next, please welcome our second speaker of the day, Dr. Manish, a leading figure in the field of health literacy with a profound focus on stroke management. With over a decade of experience, Dr. Manish began his journey in 2012 as a physician associate in neurology, where he has made significant strides in addressing critical issues of lower thrombolysis rates in Kerala. His research revealed that a lack of awareness about stroke symptoms and treatment options has been a major barrier to timely care, driving him to dedicate his career to improving stroke literacy in the Indian community. Dr. Manish pursued a PhD in public health from Symbiosis International University, where he continued his pioneering work in stroke awareness. With more than 7 publications on stroke awareness and 13 peer reviewed articles, Dr. Manish is widely recognized as an authority in this field. In addition to his research, Dr. Manish has served as a research fellow at Symbiosis International University and more recently, assistant professor. His contributions have been celebrated with the prestigious Best National Physician Associate Award in 2023 by the Indian Association of Physician Associates. Dr. Manish's work is a testament to his commitment to advancing healthcare and improving outcomes for stroke patients. Let's warmly welcome Dr. Manish Muralidharan as our second speaker. Over to you,
Yeah,
sir.
good afternoon. Good afternoon. Am I audible?
Yes, sir.
Yeah, good afternoon. I think I need the first thing I need to do is to appreciate the effort from the Manipal University. When I did talk to my colleagues that this is one of the best thing I have seen recently. There is health literacy talk which go to the public and other health expert that they look into it and learn what is the valuable insights regarding health literacy. That's one thing I need to tell. And thank you for all other participants for joining and listening me today. I will share my screen and start talking about the topic. Is it visible now?
Not yet, sir. Yes, now it's there.
Now it's visible. Okay, I
Yes.
think this topic telling is very simple. I do not want to even complicate. This is
Excuse
actually
me,
a
sir.
concern matter. Yes, yes.
Can you put it on PowerPoint mode?
It is a PowerPoint mode, I think. I'm doing actually. It's
It's
PowerPoint mode. Yeah.
it's on the
Now,
not yet, sir.
now.
It's still on the
Now my screen is visible.
yes,
Hello.
yes.
Okay. Okay. So I wanted to tell that this topic I never wanted to complicate. This is a concern I'm raising. This is not my first talk, second talk, third talk, or 10th talk, or 100th talk. I any opportunity I get, I start talking about it because this is a concern in India that the studies, even the survey I did in many states, it is telling that the recipient of stroke golden hour treatment is still 10 below 10%. That is really concerning because the facts about the stroke is the mortality regarding stroke is very high and it is usually come as the second highest cause for mortality among many nations, especially in India. And not only the mortality that creates, as everybody knows that the post-stroke disability is very concerning, that pushes people towards quality and the reduced quality of life, and the treatment cost is very high. And still the problem is below 10% of the people in India are only accessing golden hour treatment during an emergency situation of stroke, and that is really concerning to the health experts. And even though we have advanced treatment facilities, including most of the surgical treatment facilities, endovascular, thrombectomy, everything we are providing. Even in the state of Kerala, when I did many surveys, the treatment access during golden hour is below 10. That is really, really concerning, especially when we talk about a state like Kerala and Tamil Nadu. It is repeatedly showing only below 10% of the people are accessing stroke treatment during golden hours. That is one thing I want to emphasize again and again. So we need something to improve the awareness regarding stroke symptoms among Indian community. That is one thing. And early treatment seeking, if the moment see the website of American Heart Association and Stroke Association, early treatment seeking and recipients of the golden hour treatment facilities is proven to have less mortality and disability during a stroke, and that we are missing in the entire country. And one of the strong thing I want to tell is this problem we are facing every time, because the window period or the timeline to receive the golden hour treatment during an acute stroke is only 4.5 hours. So the people usually reach, many of them reach in the prim of the hours, like 6 hours, 7 hours, but still the health experts are unable to deliver the treatment because the protocol says they can receive the treatment just below 4.5 hours. So that is one of the biggest problem we are facing in India. Some people wait for the spontaneous recovery and come in the next day because they don't know the problem of stroke and its severity and its outcome. So that is very, very concerning to the health expert, especially the neurologists. Every time they talk about it, and they talk about many strategies how to improve health literacy regarding stroke. So I wanted to tell this also. As a highest cause of mortality, the health literacy literally means we need people to be educated regarding stroke symptoms and the need for early treatment seeking during a stroke. When I continue to say, many of the people suddenly identify most of the symptoms of a heart attack, and even they seek treatment, other disease, misperceiving as a heart attack. But when it comes to a stroke, most of the people are unaware about the symptoms. That has its own, broad paradigms. Like the symptoms of a stroke is usually a little subtle or sometimes vague or confusing than a heart attack. So the health education only works in that manner actually. Most of the symptoms of a stroke initially comes as very subtle or confusing, like a slurring of speech. When I go to the community and talk to them or do a survey, they say like, yes, I had a slurring of speech, but I had diabetes also. So I thought it is part of hypoglycemia. So I consumed some sugar and wait for the spontaneous recovery. And the next day I was densely hemiplegic. That is one of the commonest problem we face. And even also people who are having another medication, when they get a minute weakness in the arm, they think like it's a generalized weakness because of the medication side effect, and they wait for one day, and or they go to the bed and sleep, and after 12 hours they come to the hospital with a dense hemiplegia, aphasia and all. So the moment they feel like it is very severe, the window period is already over, because within the 4.5 hours only we can deliver the treatment. They come after the 6 hours or 7 hours or 12 hours. I have seen many, many substantial amount of patients coming to the hospital even after 2 days, 48 hours. So the health experts are concerned, more than a concern, they are very worried about this. Actually, they are very concerned about this. So the India needs some strategy to improve the health literacy regarding stroke. That is very, very relevant, and it is a concern I'm telling again. So this I already did talk about this actually, and stroke awareness should be part of basic health literacy. And when we talk about basic health literacy about stroke, they need to just identify the symptoms as an emergency, and they just need to know there is no other way to treat a stroke, but they need to reach the stroke treatment facility, and they need to be aware about only these two things. They need to be aware about what are the symptoms of the stroke and where they need to go immediately when they have a symptom identified. And this thing I'm telling again, there are so many variables I identified as a barrier during stroke treatment access. But one of the major thing is awareness regarding stroke symptoms. And we get surprised when we see the data that even from the most literate state like Kerala, many of them are not aware. Even the most educated people, even I did survey, and the health experts, some of the health experts are struggling to decode the symptom of a stroke. That is very, very concerning. So we need to improve the awareness regarding stroke symptoms. So, and also the availability, and when they identify the stroke symptom, one thing is there is no other primary treatment or the care like cardiac massage you can give, CPR, nothing. The stroke means you need to rush to the stroke treatment facility. That should be conveyed to the public, and everybody should be aware about this thing, how to identify the symptoms, and the need to rush to the hospital or the stroke treatment facility as early as possible. That is one thing I need to emphasize again. So I did many surveys, but this is very surprising that there are. I did survey, and I did publish the data also. When we asked about the people from Kerala, they say like 72% identify hemiplegia as a symptom of stroke, and 62 they identify facial weakness. The moment we say like speech, the slurring of speech, whether it is a stroke symptom, most of them say no, it is part of hyperglycemia or sometimes tiredness or something else. So 37% only. When it comes to the balance, it is 12%. And vision, it is very worrying. They most of them say like it is a eye problem or something. And acute vision loss, as a especially homonymous hemianopia or acute visual symptoms is a part of stroke. Only 8%. It is very, very concerning that only 8% of the Keralites identified it as a symptom of a stroke. So, and I say like when I did the survey, I did with many communities, and most of the health workers, they do identify most of the symptoms of the stroke. And this means there is a barrier between the health experts and the community, and it's like the awareness is still sitting within the community, but within the health system, but it is not going out to the community. That one barrier we need to break, and we need to educate everyone regarding the symptoms of the stroke. And the regional issues I will talk in the next slide also. When we talk about the educational aspects of stroke symptoms, we usually drag the signs and symptoms and even the messages from the American Stroke Association, and we directly use it. This practice we can see everywhere. Earlier, the symptoms of the stroke, it was fast, and there was only three symptoms we discussed actually, and in the pamphlets and all we used only fast, and now it is be fast. They added two more symptoms, that is balance and eye vision loss as further two symptoms which are also very common. So now I did most of the survey when we were using fast as a a short form for the identification of stroke. So I teach the people today about the fast, they learn it, and the next day when I ask my respondents or the patients what is fast, they say they suddenly remember fast, but they cannot decode the symptoms from the short form. They usually, most of them face the problem that they cannot identify more than one symptom, because we are conveying the symptoms in the same way as the American Stroke Association does. Sorry, there is a public announcement. I'm in a medical college. Yeah. So when we ask next day the patients, they say the fast is the short form of the stroke, but it is very difficult for them to decode it. And so, what the problem I think happened in most of the stroke education is we are using the same short forms and messages from the American Stroke Association, and we are not putting efforts to actually make an effort to change it to according to our community in our language. So we just tell, and again I did another survey, just removing the fast, and I made another thing like the picture with stroke symptoms, and so that worked better than the be fast short form. So it means there's a language barrier also sitting with the stroke education we are facing in India. So I want to show this thing. This is from the Spain. They made a Spanish short form for the stroke symptoms. They identified they developed the thing from the BFAST itself, but they made the short form in the Spanish language. So so the surveys say it is working much better than the using the direct form of from the HASA. So this thing we also need to consider, and we need much more better strategies how to convey the symptoms of the stroke to the regional community. Even I haven't seen any of the regional language teaching, pamphlets or messages regarding stroke symptoms, which is a concern which we need to actually, as a collective, we need to think about developing such, regional stroke strategies to push this problem forward and identify it and mitigate this problem. That is one thing I want to tell. But we need to conclude. We are sitting in a time like we need the community to be educated regarding the stroke symptoms in a very simple language. We do not need to come, when we learn about the social medicine, public health, primary care, the community's, education or perception capacity is much lower sometimes. And we need education strategies, especially regarding stroke symptoms or any other disease symptoms in a language the most common man should identify and learn, and immediately they need to take a decision that we are lacking in India. So this is a priority. So at the same time, I want to tell like there is noticeable improvement in the stroke treatment facilities. If you go to Kerala, you can see the very, their achievement is much better that they developed stroke treatment facilities in every district and multiple treatment facilities in every district also. So every regional community has an access to the stroke treatment. But what I need to convey this again, the problem is whether the treatment is available or not. Even we have the advanced facilities, what if the people, common people cannot identify symptom and seek treatment? That is the barrier we are facing at the moment. Even though we improve everything and we have the most advanced technology, people are facing challenges to identify the symptoms of the stroke, and that is a priority. And that also I discussed in the past slides, that lack of awareness we are facing, and we need better strategies to convey the stroke symptoms in simple language to the regional communities in India. I mean, maybe in another language with maybe pictures which is showing the symptoms of the stroke, or sometimes the video showing the symptoms of a stroke will work better than the short form maybe from the American Stroke Association we are tracking. So we need better strategies to spread the awareness regarding stroke symptoms. Yeah, that's it. Thank you. If any queries, you can ask.
Thank you so much, sir. Now, I would like to invite today's panel discussion moderator, Ms. Anjali Pradhan, a research scholar under Dr. Usha Rani's guidance in the Health Literacy Unit, PSPH MAHE. Her research on mental health literacy focuses on improving public understanding and developing educational interventions. It aims to bridge gaps in mental health knowledge and enhance community support through innovative strategies and evidence-based approaches. Over to you, ma'am.
Thank you for the kind introduction, Ms. Pallavi. Hello, everyone, and welcome to today's webinar. I'm delighted to be the moderator for this session. So before we begin, I offer my deep respect to the coordinator of Manipal Health Literacy Unit, Dr. Usha Rani. And I would like to extend my warm welcome to our esteemed speakers, Flavian and Dr. Manish. We are privileged to have you with us today. You've shared with us your insights and expertise on indicators and characteristics of health literacy responsiveness of healthcare professionals in the care environment, and knowledge, skills, and attitudes as healthcare professional competences, and competence being the indicator of responsiveness, and beautifully presented the model of communication label in health literacy, ma'am. And indeed, Dr. Manish, health literacy is a major barrier to the ability of stroke patient to reduce their risk of stroke. So due to inadequate health literacy, it of course leads to less understanding of medical conditions or lack of understanding of medical instructions or non-compliance to the treatment, etc. So the informations are valuable. Thank you so much for that engaging presentations. We appreciate your time and effort put forth. So without further ado, let's get started with this part of the session. I have a few questions for the speakers, so let's dive into the discussion. Right. So our eminent speaker, Flavian Rocha. Hello, ma'am.
Oh.
She's a researcher, master's and PhD holder, and a member of Brazilian Health Literacy Network. So, ma'am, from your personal perspective, how does health literacy impact on healthcare and communication?
Well, as someone deeply involved with healthcare, I have seen firsthand how critical health literacy is to patient outcome. When patients understand their health condition and the steps needed to manage them, communication with healthcare providers become more effective, leading to better adherence to treatment plans and less complications. Health literacy empowerment patients, make them active participants in their care, which is essential for both the well-being and efficient healthcare system.
I appreciate your valuable perspective, ma'am. So Flavian's research focuses or emphasizes on the development of technology to promote health and literacy. So question to you, ma'am, how can technology be leveraged to advance health literacy?
Well, I think technology has a big paper in this situation. For example, in the use of technology and mobile phone videos, we use simulations in healthcare to improve ability in our patients. This is a kind of examples when you use that in healthcare.
Great insight. Thank you, ma'am. Next eminent speaker, Dr. Manish Muralidharan. Hi, sir.
Hi.
He's an active social medicine researcher with various projects and publications related to health-seeking behavior and social determinants of health. So, sir, what are the most significant social determinants of health and how do they impact health-seeking behavior?
One thing I see that the disparity between various diseases and its awareness. So when we talk about some disease like heart attack, many people are aware. But the moment we are telling about stroke or a cancer, most of the people cannot identify the disease symptoms. Especially in the early stage, they miss out the symptoms and they do not seek treatment. That pushes them forward to a more bigger catastrophe that can cause the severity of the illness higher when they treat the segment, seeking the treatment in a later stage, that increase the not only the mortality rate, but also the expenditure for the health will be very, very high during in an advanced stage. And also, I think I have to tell this also, in a country like in India, the socio-economic barrier is also very high. Like even though we are providing the healthcare in a very advanced stage, like we have the most advanced treatment facilities, but how many of our people are actually accessible to that? How many of them are having enough capability to pay for that healthcare? When it comes to the public health system also, it is not enough to provide the entire community. It is not actually sufficient to serve the entire community. So we are facing a divide in the socio-economic strata, especially in many states. We are watching it actually because they cannot seek treatment just because they are worried about the catastrophe. That cannot happen in a health system. So we need something to prevent that also. These two things I emphasize in every talk. One thing is awareness regarding the disease, and second thing how to manage the division between socioeconomic strata. Yeah.
Thank you for the clear explanation, sir. So, Dr. Mahesh has immense experience in conducting qualitative research and publication, especially phenomenological approach. So, question to you, sir, what research methods can be used to study health-seeking behavior and social determinants of health?
I have to say this way, like when we are implementing a survey, the survey questionnaire will be limited. I mean, we cannot, the questionnaire exhaustion everybody knows, like we cannot include the questionnaire in the number of questions we can include is maximum 40, I think. More than that, it will be exhausting. But the moment we are going to the community, the variables they are telling is very different. So we cannot include every variable in the questionnaire. So we need qualitative research to sit with them and understand what is their real problem. As I said, when I did the qualitative research, I understood they cannot really actually decipher or decode the BFAST. Otherwise, we think like they haven't heard it. They haven't, they cannot understand it, but they heard it. They learned it, but they cannot decode it. When I sit with the respondents and ask what is the problem they face, they literally tell in a verbal manner that this is the problem I'm facing. So qualitative research is very important in health seeking analysis, especially I am very happy when it is a mixed method. So you do a survey first and you identify the most important variable. And if you do a qualitative research further, and you identify the hidden variables further. So I did most of the studies in mixed method manner, including survey with phenomenology. So I prefer this should be a mixed method approach.
Great point. Thank you, sir. So, Flavian, okay, I'm very enthusiastic to know about the strategies that you found to be effective in improving health literacy. And with that, can you please share an example of a successful health literacy initiative that you have been involved in?
Yes, of course. One effective strategy in improve health literacy is the use of the teach-back method, where patients are asking to repeat information in their own words. This confirm they understand and allow for clarification if need. I've been involved in an initiative where we implemented this approach across several clinics. The results were promising, with significant improvement in patients' adherence to treatment and overall satisfaction.
Okay, and what advice would you like to give to an organization or an individual who are looking to enhance their health literacy initiative?
So in this case, my advice for organization or individual looking to enhance their health literacy effort is to start by understand the specific needs of your audience. Tailor your materials to be clear, concise, and culturally relevant. Engage with your audience using simple language and visuals, and consider integrating feedback loops like surveys or focus group to continuously improve your strategy. Building partnership with community organization can also extend your reach and impact. I believe that.
Thank you. Thank you so much for sharing this information. So, Dr. Manish, if I may ask, what personal experience or observation has influenced the most in your research in health-seeking behavior?
So I think there is a divide between even the disease which we are talking. Like some of the disease get more emphasized, and the education goes that way. But I'm telling, like I already said that when we talk about heart attack, the education is everywhere, and most of the people even know when we have a heart attack. Even the common man knows what to do during a heart attack. Even one patient goes unconscious, they suddenly try to do CPR somehow and it saves a life. But when it comes to stroke, they go everywhere, like get very chaos. Like I have seen this. I was a physician assistant in neurology, and many of the respondents tells like we had no idea what is happening because they think like it is part of sometimes the hypoglycemia. Sometimes they think I was working in the entire day, so I got some of the problems. Sometimes they think like suddenly they have a sudden vision loss. Sometimes they perceive it is like a problem with the specs. It is very common that we are having a problem. So the problem which I'm telling is this needs a clear education strategy to improve every disease, and basic symptoms of every disease should be conveyed. It should not target on one disease. We know that the major cause of mortality is heart attack, but when it comes consider stroke, it is second most major cause of mortality. But at the same time, post-stroke disability is most worrying. More than a heart attack, it is most worrying that the quality of life of the patient as well as the caregiver will be downfalling suddenly. So, and also I need to emphasize this moment. I've started talking about cancer also. Most of the people are ignoring the symptoms of the cancer early, especially when we talk about breast cancer and all. Most of the common people are unaware how to identify the early symptoms of the cancer. So many of them ignore, and they come in the advanced stage, and that time the expense of the treatment is high, mortality rate is high, disability rate is also high. So we need a uniform strategy to educate most of the common disease, including stroke, heart attack, cancer, and also infections. This is very important.
And how do you see the field of social medicine in the next decade? And what role will research on health-seeking behavior play in that evolution?
I think I already discussed this in my entire talk, that when the moment we are telling we have the advanced facilities developed already, but the problem we are facing is the people are not approaching to the treatment in the exact time when they need to seek the treatment. They are delaying the treatment because of various barriers like lower awareness regarding the symptoms. Even though we have the most advanced stage of health system, our health seeking behavior and our health is still sitting in the regional factors. Everybody knows that we are still so regional in culture. Even our diet pattern is sitting with the culture. So we need to study that to improve the health system instead of developing. Now we are in a stage of like we have the AI, we have the digital systems. So we are in an advanced stage. So as a social medicine scientist, our dialogue is we cannot it will never be ignored, like the cultural factors, the personal factors the people are facing while treatment seeking. It can never be ignored. It is a priority. Like when I see treatment seeking for some of the disease, just because of the cultural factors they do not want to seek the treatment. That should be identified through the the study which goes to identify the embedded factors in every community, and we need to come up with strategies to make them aware the health is a priority, and you should continue practicing the culture along with the health seeking, which is a priority. We need that. In my research also, I already said that we did try the awareness improvement for stroke, but the problem is language barrier. Such studies come from the social medicine scientists only. So we thought that we are giving enough education, be fast, but they cannot actually decode it because it is English. So it is very important to identify such variables.
Indeed. Thank you, sir. So my final question to Flavian is, what are the challenges faced regarding the responsiveness of professionals to patients' health literacy?
That's a good question. But one of the biggest challenge is ensure that healthcare professionals are responsive to health, to patient health literacy is the lack of adequate training. Many professionals may not fully recognize the impact of health teachers or maybe struggle to adjust their communication style accordingly. Overcoming this challenge requires ongoing education and the development of practical tools that can be easily integrated into daily routine, and encouraging a culture of empathy and patient-centered care is also crucial. I think is the main point.
Insightful. Thank you, ma'am. So, as Sir has already, Dr. Manish has already mentioned about the socioeconomic status. So, India is a land of culture and linguistic diversity. So in India, despite improvements to healthcare access, there are healthcare disparities, socioeconomic status, or environmental factors, or cultural factors. They are all constituted by high out-of-pocket expenditure, posing the financial burden of healthcare to the country. So, Dr. Manish, what can be the implementations that can be effective to stroke education in Indian regions?
I say this way, like even it is not only about stroke, but any disease or the strategies when we are developing. When I read articles from Lancet, they literally tell every time India is like a nation within a nation. Like we can see the divide. Like when I talk about maternal mortality, we will be surprised. Like Kerala comes up with 20, around 90 sometimes, but one other stage like Assam, it is above 150. So such kind of a divide we have. So more than equality, we are seeking equity in India. So there should be very regionally diverse educational strategies or implementation we are demanding. Like the strategy to teach health education for stroke in Kerala will never work in Assam. They need more precise or more subtle, more culturally related educational strategies. We need such kind of very regionalized strategies. So we are a very diverse country. So our strategies should be very focused on a community more than a nation. A strategy which educate the entire nation usually don't work in India. That is what my observation from the reading. And you can see every data comes, even our Nidhi Aayog data tells it. You can see the score from Bihar to Kerala is like a tremendous difference we are watching. So the strategies for any health education should be different. Even the allocation of fund will be different. For the stroke, it is very imperative that we need regional strategies to educate people, and every state should be taking responsibility to teach the people in every state in a manner they should understand what is the symptom of stroke and the need to rush to the hospital in their own language actually, not in a national language, but emphasizing in a regional language they need to convey it.
Oh, yes. Thank you so much, sir. So finally, I'm grateful to Flavian and Dr. Manish for providing valuable perspectives and information. So, and I believe all the participants have received quality information from this discussion as well. So thank you all for joining us. Over to you, Ms. Pallavi.
Thank you. So, we have come to the end of this panel discussion, which also brings us to the end of today's session. It has been such an honor to be a part of such a fantastic event on behalf of Manipal Health Literacy Unit and Symbiosis International University. So I want to extend my heartfelt gratitude to our esteemed speakers, moderator, faculty, staff, MAHE students, and MHLU members. Ultimately, I extend a heartfelt thanks to Dr. Cherian Burgess, Director, Prasanna School of Public Health, MAHE Manipal, MAHE Press, and Media Administration, and all the support we have received. I have not mentioned the names, but many thanks to everyone who has contributed directly and indirectly to contributing to this webinar. I hope you have a wonderful day ahead. Thank you.
Thank you.
Thank you, everyone. And thank you, Pallavi, for hosting this. And thank you, Anjali, for being the moderator. Thank you.